Today is World Mental Health Day, a day to raise awareness about mental health issues around the world and to talk about what more needs to be done to make mental health care a reality for people worldwide. Joining us now is clinical psychologist and partner at Thriving Center of Psychology, Dr. Doug Polster. Dr. Polster, welcome to Bloom. It's great to see you.
Thank you for having me.
So today is a day that, the world is talking about mental health, but I just want to bring it back a little bit to what happened here in Florida, which really is a reminder to so many people as they watched, millions and millions of people watched as we were slammed with this devastating hurricane, about how life just like that can change for people.
Yeah, I think in times like these, it's important to recognize that mental health isn't just for individuals that have depression or anxiety, right? When you go through an unexpected challenge like this, a traumatic experience, the most healthy people in the world will still be affected, right? Mm-hmm. The brain is resilient, but after time, your resources wear out. And checking on your mental health is ever so important when you go through a tragedy.
Yeah, and you and I have been talking about this because when you're going through something super traumatic, whether it be a Hurricane Ian or whatever's going on in your life, you tend to go into that fight or flight mode. And sometimes just the other side of that can be what really, really drains you emotionally.
Yeah, I think that's where we tend to forget about ourselves, right? We power through, we push through, we do feats that we never thought were possible. And then we're exhausted, rightfully so, but we're also mentally exhausted. And that's the time to be more preventative rather than having to wait until there's a crisis, mental health crisis for yourself. Right? Reaching out, asking for help, having a cathartic conversation with friends and family about what you've been through, and maybe even seeking the support of a professional so that you prevent any long-term challenges that might come from it, because they can creep up on you pretty quickly.
Yeah, and we saw during the pandemic that mental health and this conversation, a lot of the stigma is being slowly peeled away, where more and more people are realizing that it's okay to talk about mental health. And on days like World Mental Health Day, we raise awareness, but this is a conversation that we should be having 24/7.
Absolutely. You took the words out of my mouth. I think we've seen on our website, right, we have a free matchmaker and people come in, and we've noticed that there's been more and more people coming in over the last few years, which means that there's clearly some destigmatization going on. People are more aware, they're looking and seeking for help, right? But that doesn't mean that there's not more we can do, because there's thousands, if not millions more people that probably would benefit from a chat with a therapist.
Yeah, and one of the big missions of World Mental Health Day is to talk about the next steps of what needs to be done. So from your scope, what would that be?
Man, if I could talk to an insurance company, right, face to face, I think just like you go in for an annual physical, right, to check the body out, it would be amazing if people had access to sort of at least an annual or at least every couple months kind of mental health physical, right? We went for a check-in and learned about yourself and learned whether things that I can do to preventing stress, preventing buildup of anxiety or depression. Perfect world, that would be fantastic.
Is there such a thing as preventative mental health therapy?
Yeah, I think in a way, if you get to a professional sooner rather than later, right? Very similar to dieting, right? If you've gained a lot of weight, now we're in treatment, right? But if you recognize earlier on the signs of maybe unhealthy eating and gaining too much weight, and you get to a dietitian or a professional, you can be more preventative and more proactive. It's very similar with therapy. If you're starting to notice yourself feeling a little more anxious, feeling a little more down, your actions aren't what they normally were, you're isolating a bit, you're not having as much fun with your friends, that's the time to talk to a therapist. Jump online, do a quick Google search, fill out our matchmaker, whatever it may be, to jump in with someone earlier on so that you can prevent any significant crisis down the road, and you can actually be proactive.
What would you say are some of the misconceptions about therapy? I'm sure what you just mentioned is one of them, where people think that they should only call a therapist when they're in a time of crisis. But what are some other misconceptions?
I think one of the big ones is therapy is not what you see on TV. Right. It's not all lay on the couch and do word associations, right? Good evidence-based therapy is a bi-directional conversation where you gain insight into yourself, you learn skills, and you actually make progress. Yes, it's a little uncomfortable, but it's definitely not as awkward as you see on TV. So I think that's a big one that people realize once they go in. It's not quite what they thought it was.
Yeah, I want to pull off what you just said. For some people, they might be scared to go because they think it's going to be so uncomfortable, but sometimes having those slightly uncomfortable moments can pay off so greatly in the long run.
So I have a phrase. I say therapy is practicing getting comfortable being uncomfortable so you can be comfortable again. And starting that process is typically the biggest discomfort. And so we have, people in our office that actually talk to you like a human, one-on-one, not a computer, to learn what your needs are, educate you about the process, get you matched with somebody so that we reduce the discomfort of that initial step so that you can get the ball rolling.
So what do you think people could learn about themselves? Because there are folks that might be watching right now that have never been to a therapist or have only been to a therapist during a time of crisis, and once they got through that difficult period of time, they kind of said, all right, I'm all good. But what are some of the things with this preventative type of therapy that you talk about that we can learn?
So I think one of the things that everybody can resonate with is procrastination, right? Procrastination in psychology terms is fear avoidance. We don't want to do something because we're stressful, we're worried about the outcome, or something might bad happen, so we hold back, right? So therapy would be about learning about why am I holding back, what is holding me back, and how do I maneuver around that and make it more comfortable so that I feel more confident the next time that thing comes up in front of me. I feel more like I can do it, I can take positive steps forward. And so everybody could benefit from that because we all procrastinate. And I think that's a very simple explanation of how we could be preventative and proactive in therapy.
And last but not least, I wanted to ask you, a lot of people are dealing with, trauma that they've experienced earlier on in life, and then they've buried it. Can therapy help with that? Because some people might not want to go back and face those demons.
Absolutely. And I think it's one of the things that, whether you've had a traumatic upbringing or just a regular upbringing, whatever that may mean, our past informs how we feel in the present. And so therapy is about gradually unlocking those boxes that we may have locked in the closets of our mind, right? Safely doing it, empathetically doing it, and learning how to gradually, like a child looking under the bed to see if there's a monster, and recognizing that I can confront the monster in a safe space so that that monster is no longer as big and scary.
Dr. Polster, it's great seeing you. Thank you so much for joining us on Bloom today.
No problem. Thanks for having me.
And to read more about this story, just head to our website and stick